Multiple Myeloma, a presentation by Valerie Del Valle. Hello class, my name is Valerie Del Valle and I am presenting multiple myeloma as my disease topic for this discussion. As the name multiple myeloma suggests, it is a complicated disease that involves multiple organ systems. It is a complex disease to diagnose as well as treat. Multiple myeloma accounts for approximately 10% of hematologic malignancies, which are blood cancers. Slightly more common among men. Median age of diagnosis is 65. It's twice as common among African Americans than Caucasians and is less common among Hispanics. What is multiple myeloma? What multiple myeloma is essentially is a blood plasma disorder that begins in the bone marrow that destroys T cells and ultimately multiple organ systems simultaneously over time. There is no known cause for multiple myeloma. Dr. Rajkumar discusses the criteria for diagnosis, among which are 4 things commonly looked for, which are represented by the acronym CRAB, CRAB. The C is for calcium. Hypercalcemia means there's too much calcium in the blood. The R is for renal or kidney failure. The A is for anemia, which is nutrient deficient blood, especially iron, and B is for bone, as in lytic bone lesions, which occur mostly on the spine and skull. Multiple myeloma affects several organ systems: the circulatory vascular system, the urinary system, and less common, the central nervous system. There are no known cures for multiple myeloma. However, variable treatment combinations have enjoyed measurable success. Treatments for multiple myeloma include high-dose chemotherapy, which kills malignant cells, giving healthy cells an advantage, immunodulatory drugs, or agents called IMiDs for short, which boost the immune system, monoclonal antibodies, a type of immunotherapy that targets specific proteins on cancer cells, and autologous stem cell transplant, called ASCT for short, using either their own stem cells, which are harvested before treatment and then given back to the patient, or from donor stem cells from a family member or somebody else, or an umbilical cord, stem cells from an umbilical cord after a baby is born. Managing symptoms for patients with multiple myeloma proves to be a challenge for healthcare workers for several reasons, which are also compound and complex. According to Beth Fairman, this is because of the average age of the patients, the cumulative morbidities, and the side effects of the medications. Maintaining a healthy diet and exercise routine is important, and it is commonly known that exercise also helps with stress management, which is another factor to consider. Some might find support group, either in person or online, a helpful way to process, learn, and cope with the new navigations of life. The fact that we have the technology to offer such an aggressive response to such a terrible disease shows God's sovereign hand in His love and dealings with mankind. And this concludes my presentation. Thank you.